Good morning, friends. Today, as we all know, the COVID-19 virus, which first started to infect in Wuhan, the province of China, later on it spread into the neighboring vicinity of China. Thereafter, the virus outbreak was found throughout the world. Now, the disease, which started as an epidemic in a small province of China, later on developed into a pandemic situation. This is what we shall try to understand. In order to understand this, how an individual infected the entire world, we need to understand this terminology. That is epidemiology. This is derived from a Greek word epidemic. Epidemic. Epidemic means outbreak or spread of a disease in a large number of population, in a large number of population at a given time. This is important. Epidemic is nothing but a spread of a disease or outbreak of an infection in a large number of population at a given time. The science which deals with the study of epidemic is nothing but epidemiology. Now, the word epidemiology is made up of three Greek words. This is epi, demos, and third one is logos. Epi. Epi means among or upon. Demos means population or people, and logos means study. Now, the word epidemiology is related to the study of a disease on the population or health related issues on a population, and the study is scientific study. It involves surveillance, collection of data, data analysis, and then intervention. All this comes under the word epidemiology. Now let's define epidemiology. The branch of medicine, of medicine which deals with incidence of the frequency, distribution, and determinant of health related issues or problems among the population to find This is important. Possible control of the disease. Now, in this definition, we are going to look into specific terms. The branch of medicine which deals with or studies the incidence, frequency, distribution, and determinants of health related issues among the population. What is the aim of epidemiologist? Let's understand who is epidemiologist. The person who studies about the epidemiology or who is an expert in this department is known as epidemiologist. The main goal of epidemiologist is to find a possible control for the disease. The control should be such that the outbreak of disease can be curtailed, can be stopped from spreading from one person to another. So, let's see what is the difference between a clinician and an epidemiologist. I hope you have understood this definition. Let me repeat that. The branch of medicine which deals with the incidence, frequency, distribution and determinants of health related issue among the population to find the possible control of the disease. All these three words are included in this definition, that is among the population and study, right? Let's understand one by one. Now, study. What kind of study is epidemiology? It's a scientific study. Remember this. It is a scientific study which includes surveillance. These are important terms. Please try to understand. This includes surveillance, data collection, analysis of data, and intervention. Now, epidemiology is a scientific study, right? It has to follow a specific pattern. The study is defined and the path is already been finalized for the study. It's a scientific study which includes surveillance of the people to collect the data. The data collected undergoes statistical analysis to find a possible control in terms of intervention. For example, in a population of Nasik, a study was conducted to find a relation between the smokers and lung cancer. Now, what we have got, suppose the population of Nasik is 1 lakh. Let's assume it's 1 lakh. Out of this 1 lakh, say we have got 25,000 smokers, and out of that 25,000 smokers, we have gotten concrete evidence that 20,000 smokers are suffering from lung cancer. Now, let's understand in terms of epidemiology, we have got a population, surveillance. After the surveillance, we have got the data which presents 25,000 are smokers out of 1 lakh population, and among that 20,000 are suffering from lung cancer. Now we have got the data collection, right? Analysis is made in terms of statistics. Now intervention. What will be the intervention to prevent this from happening? Number one, the government can provide a guidelines to stop smoking to various advertisement by increasing the rate of to prevent the sales. To decrease the sales, the government can increase the rate. Now, in order to understand that smoking is a cause for lung disease, this is important. You need to know what is epidemiology. Now, in case of COVID-19, the government has given certain guidelines. For example, lockdown, stay at your home, maintain a social distance of about 1 meter, wash your hand. All these guidelines came into force after the study. So this branch is important to prevent the spread of disease in the community. Right? Now we have cleared this term study. Let us understand the incidence and frequency. Now the next term we are going to understand is incidence or frequency. Incidence is nothing but number of new cases. Remember that, number of new cases. All new cases comes under the word incidence in the population. Now prevalence, let us understand the other term, that is prevalence. Prevalence denotes all new cases plus old cases present in the population. New plus old. The old cases which happened to take place in the past also is included along with the new in the word prevalence. Now, frequency of disease is nothing but the numbers which tells about the rate, the ratio, mainly in terms of mortality, morbidity of the disease. The rate at which the disease is spreading in the population is defined by frequency. The ratio is obtained by comparing the previous data. Right? Now, frequency is nothing but numbers. Remember this. Now, what is mortality? Mortality is number of death in a given population due to the outbreak of an infection. Morbidity means number of cases in a population. Right? Okay. Let's understand the next word, that is distribution. The next word is distribution. Distribution. Distribution is nothing but the pattern in which a disease spreads in a population. Pattern which represents the spread of a disease in a population. Distribution is related to three main words: person, place, and time. The pattern in which a disease spreads in a population is represented by the word distribution. Now, this also represents when, where, and what happened. When was there outbreak of the disease? When, where represents place, and what kind of outbreak was there, that represents the cause of the outbreak. With respect to person, distribution can be differentiated with respect to age of the person, marital status, whether married or unmarried, socio-economic status, dietary habit, behavioral habit, which includes smoking, alcohol consumption. Now, what we are trying to understand, the pattern in which the disease has spread in the population, whether it is age specific, just as in a recent example, what we are looking into, COVID-19 kills majority of the people belonging to older age group. This was a pattern that we have got after the analysis of the data. Now, place represent whether it is North India, the disease, whether it is occurring in North India, whether the disease is occurring in the South India. Place, geographical location is important, whether the disease is confined to an Asia, African, or other continents. Now, these are place. For example, certain diseases are localized to a specific area. Now, time, climatic variation, seasonal, whether it's a seasonal outbreak, annual outbreak. It can be related to day, evening, night, all this breakup. Now, when we study the distribution or the pattern of the disease, we need to understand in relation to person, place, and time. Now, let's come to the third word, that is determinant. Determinant. Now, once we have got the data, after studying the frequency of the disease plus distribution of the disease, we reach to a final conclusion. By studying the frequency and the distribution of the disease, we get the answer when, where, what. After these two datas, we reach to a possible hypothesis. Hypothesis is nothing but assumption. In order to reach to an hypothesis, we need to study the data which we get after monitoring these two parameters, that is frequency of the disease and distribution of the disease. Once we get the hypothesis or assumption that such and such factor was responsible, such and such causative agent was responsible for the outbreak of the disease, we land into an important term, that is determinant. Determinant is nothing but the conclusion arrived after studying the frequency and distribution pattern of the disease. Now, in the determinant, we get the exact, we know, we reach to a conclusion to get the exact cause of disease, risk factor, exact risk factor, means with determinant we get the answer to the question how and why. Causative agent, exact, and how did the disease spread in the community. Now, after going through all this, frequency, distribution and determinant, the role of epidemiologist is to find a possible control of the disease, to prevent it from further spreading into the population. Right? Let us understand difference between an clinician and epidemiologist. A clinician is confined to an individual patient, while the epidemiologist is confined to the entire community. Both clinician and epidemiologist are dealing with a disease. They use the same pattern to reach to a diagnosis, including clinical observation, lab findings. All these are used to reach to a possible diagnosis. But the main aim of a clinician is to cure the individual, while the aim of epidemiologist is to cure the entire community and to prevent the further outbreak of the disease. Right? But both of them use the same parameters. Is this clear? Right. Now, regarding component of epidemiology, these are this frequency, distribution and determinants are nothing but component of epidemiology. Right? Let us now understand the types of epidemiology. Types. These are divided into two types. One is descriptive epidemiology, and next is analytic epidemiology. Now, descriptive epidemiology involves the study about the frequency of the disease and distribution, right? And analytic means descriptive epidemiology includes frequency, right? Let me write this, frequency and distribution, right? And analytic epidemiology includes determinants. Determinants. Analytic epidemiology, before reaching to analytic epidemiology, we need to conclude this part, descriptive epidemiology. Without this, it's not possible to reach to the analytic epidemiology, right? Then descriptive epidemiology involves frequency of the study of frequency of the disease and distribution. Distribution in terms of person, place and time, pattern of the spread of the disease, right? And analytic epidemiology deals with the determinants, means this is the final or conclusive path, conclusive path to prevent the outbreak of disease, right? Now, why do we need epidemiology? Why do we need to study epidemiology? Let us understand this. An individual comes together to form a family. Few family comes together to form a neighborhood or a society. The society then forms a state. The state forms a nation. The nation forms continent, and the continent forms the globe or the world, represents the world. Now, when the outbreak of disease is confined to an individual, it's a role of the clinician to get this cured, to knock this disease, right? But when this spreads into a community, when this spreads into a larger population, when this spreads into entire continent, a clinician is not the right person to handle this situation. This is epidemic and this is pandemic throughout the world. Now, the study of epidemic forms the base of public health system. After the surveillance, the data which is obtained undergoes vigorous statistical analysis and provides possible solution or possible method of intervention to prevent the spread of disease into a larger population. So, the data obtained is used by government official to define what an individual has to do in case of outbreak of a disease, right? In broader way, epidemiology is nothing but a science which deals with the health related issue of a population. It's an important branch which is used by the government to finalize its future health programs for a society, right? Okay. Okay, let us first revise this definition of epidemiology and we'll sum up today's lecture. Epidemiology is a branch of science which deals with the incidence, frequency, distribution and determinants of health related issues among the population to find out possible control of disease. Right? Is it clear? Now, what is the difference between epidemiologist and clinician? Epidemiologist deals with the society, clinician deals with the individual person. Component of epidemiology, that is frequency, distribution and determinants. These are the three main components of epidemiology. Types of epidemiology: descriptive and analytic. Descriptive includes frequency and distribution, while determinant, the conclusive part for intervention, comes under analytic epidemiology. And epidemiology is the base of any public health, right? Thank you.